Hey everybody, talking a little bit more about does this patient have Hallux rigidus? Not so common when you first look at it. However, you may find initially that there's a little bit of extra bulging or the big toe joint's a little bit swollen. When you start to have a bit of a chat with the patient, they're going to say that there's some aching, there's some throbbing, there might be some sharp shooting pain as that patient tends to toe off or during walking. And when we then see it on the x-rays, you're going to see something similar to this, where that joint space has been eroded, there's a lot of osteophytes there, and there may be cysts of the bone, depending on what stage it is up to. When you're looking through that first MTPJ, that metatarsophalangeal joint or the big toe joint, the range of motion is going to be very limited. And at end stage disease, it may be pseudo-fused or there may not be any range of motion available. It is going to be very much pain limited, and although there may be that potential that you can see some joint space, the pain is going to stop you because the patient will be saying, no more doc, that's enough, that's enough. What I typically see is that there is going to be pain to that dorsomedial area and the medial area, but particularly within that first interspace, that intermetatarsal space, you're going to be able to find a lot of osteophytes around that area. It's going to be quite prominent and it's going to be very osseous or bony in nature, which is a telltale sign that it's a little bit more like Hallux rigidus than, let's say, a bunion deformity that's occurring there. You'll also notice that when they're walking, they tend to walk off through their lesser toes or a low gear propulsive moment. Or if they're in, not finding that that's comfortable, potentially due to other hammer toes or lesser metatarsal pathology or conditions, they may be really coming off that medial and dragging their foot through so they don't have to activate that first metatarsophalangeal joint, and because they don't have any range there. And so, hopefully this gives you a little bit of a picture of whether this patient might have Hallux rigidus. If you're liking this sort of content, hit the subscribe button, have a bit of a look at some of our other videos. Write any comments that you might find, or that you want answered, and I'll be sure to answer those as well. But for the moment, we'll see you in the next session. Cheers.